Welcome back, everyone. One kind of therapy we've never discussed on the podcast before is acceptance and commitment therapy. With us to talk about that today is Dr. Joe Oliver. Dr. Joe Oliver is a consultant clinical psychologist. He's the founder of Contextual Consulting, an organization providing training, supervision, and therapy in acceptance and commitment therapy. He's also an associate professor and overall program director of the UCL CBT for severe mental health problems postgrad program. He's written 6 ACT books. He has his own YouTube channel dedicated to discussing acceptance and commitment therapy, and we're very pleased to have him with us today. Joe, thank you so much for joining me.
Alex, thanks so much for having me on the show. It's great to be here.
As I told you offline, my knowledge about ACT is quite poor. I'm excited to learn more about that today. I've been watching some videos on your YouTube channel. Maybe you could start. I'm actually quite curious, where does ACT come from in the history of therapy, in the lineage of therapy, very, very short history that psychotherapy has? How and when did ACT come about?
Yeah, okay, that's a good question. I think I always like to start with history, right? Knowing history just gives me a sense of where it's come from. Yeah, its lineage is a really nice way to put it. So one starting point, a peculiarity about it is that it's known as ACT rather than ACT, which is, well, you'll hear a little bit about why that was done, but it's kind of different to most other therapies, which have their acronyms, CFT, CBT, so on and so forth. But this is the one that's chosen to be a little bit different in that regard. So the lineage, and it's a good point you make, that psychotherapy is not really that old, is it? 100 years or so, maybe 150 if we're lucky. So the ACT tradition goes back to the early days of behaviorism and behavior analysis. So the days in the origins from when behavior analysis came about, which was an approach, a scientific endeavor looking at helping people to have more input, you could say, into their own behavior, to shape up and modify and move their own behavior, and of course for those in helping professions to help and move and shape other people's behavior. So behaviorism then, developed in the 1950s and 1960s and was quite revolutionary in a lot of ways, which is to say not necessarily better or worse than anything else, but it was quite different from other approaches such as psychoanalysis or psychodynamic approaches. And I think shone a really interesting light, you could say, on the sort of the prism of what it means to be human, just a very different way to look at it. And one of the things that evolved out of behaviorism was a deep interest in thinking and thought from this tradition, and then all sorts of approaches like cognitive behavior therapy or cognitive therapy evolved. And then more recently was another evolution or another change. It's been called another wave by some people, which was the third wave of behavioral approaches, and of which ACT was one, acceptance and commitment therapy. And this third wave was really interested in, rather than, you could say, changing or seeking to change internal experiences, developing and helping people have a stance of acceptance towards internal experiences, being very mindful in the present moment, and helping to modify and adjust in terms of the stance towards our experience, and with a key focus on values, which is to say helping people move towards what's important to them in their lives. I guess that's a little whistle-stop tour of the history. These from behaviorism, and this first wave of behaviorism, second wave, the cognitive wave, and the third wave is the approaches that have been very interested in this idea of acceptance and present momentness.
And I guess that developmental trajectory makes sense, because I suppose one of the critiques of behaviorism is that it's a little bit too superficial to see everything in terms of someone's behavioral inputs and outputs. A lot of people I understand found that to be a little bit reductive. So as you go from first wave behaviorism to second wave CBT, where you're thinking about someone's thoughts and emotions, and now third wave, you're talking about ACT, the therapy we're discussing today, and we're talking about values. I'm actually quite excited by that, because I think values are so important in therapy, but they're very rarely talked about. I think you talk about values a little bit in humanistic therapies and existential therapies, although often not explicitly. And I've done a whole humanistic training. I think ACT might be the first kind of therapy I've come across which explicitly talks about values. Is that what drew you to working with this model?
It was one of the things. It's curiously, there's a couple of things that drew me to it. One was my sort of nerdy, geeky interest in the science and the theory of human language, relational frame theory. We can get onto that maybe a bit later. Actually, what personally drew me to the model was this idea of acceptance. It's such a funny term, but it was. I don't know if you're the same, or I'm sure other people are, but maybe therapists in general. But I think we sort of get drawn to the approaches that resonate, right? And there was something for me about this idea about I don't necessarily have to change things on the inside until I can go out and do things and lead my life, for example. And I felt like it's probably sort of speaking to a version of me that was younger, in my late 20s, early 30s, and was struggling with different things or struggling with anxiety. And there was this kind of like always a sense like I need to not be anxious, and then I can go out and live and do things. And the acceptance model or acceptance-based models emphasize this idea that we don't necessarily have to change, but sometimes a lot of the problems that we face comes when we're overly focused on that change, trying to eliminate or not have those experiences, and we get ourselves stuck. And of course, there's this kind of peculiar thing that happens when one, or at least I found when I just had a little bit more space from that, which is, of course, it brings up values types of questions like, okay, if I'm not struggling, if I'm not just focusing on not having anxiety, like, what do I want to be able to do then? Or in the presence of things that are difficult or stressful or painful, like, how do I choose to be with myself and how do I choose to act? Which again, like sort of values questions, and they're kind of nice questions. And, I know lots of therapies have their way of asking those questions, but ACT, I guess, has its sort of front and center in the model and goes for those things pretty quickly.
I resonate a lot with what you're saying. What I'm understanding is that often we want to change aspects of our psychology, like, oh, we want to be less anxious, or someone else might say, I want to be more happy. But often it's quite hard to induce those changes directly. Often those changes, like being less anxious, being more happy, are more of a byproduct of the things we do and other things which may seem on the surface unrelated. So are you saying that ACT would promote kind of a philosophy of trying to go out and live in accordance with your values, and then internal shifts can happen as a consequence of that? Do I have that right?
That's a nice way to put it. Yeah, absolutely. Rather than the other way around, which is possibly maybe a common sense way of looking at it, like, well, perhaps at least a Western cultural ideal that happiness is good, or once we feel happy, then life will be good, or to do things, I need to feel confident, or to connect with other people, I need to feel strong or not sad. It's kind of an idea that my internal world needs to be aligned in a certain way, and then I'll be able to go out and do things, which, you can sort of, it makes some sense in a way. Like, I can get the understanding of where that has come from, or why someone might kind of get caught with that idea. Just the obvious problem comes about, like, well, what do you do if you're sad, or if you've lost someone close to you and you're grieving, or if you're going through a stressful time and you're feeling the anxiety that anyone experiences, or if you go to do public speaking and your heart starts racing because you worry about things falling apart and the normal, natural things of life. And if my mind goes, I must not have those experiences before I take action, then if I adhere to that rule, my life will get slowly, increasingly smaller and get quite tight and narrow. So the ACT idea, it's not obviously just ACT, but the sort of the principle underneath that is, let's develop a different way of being with those experiences, and at the same time ask myself the question, like, what matters, what's important, like, what do you want to do? And there's a very active part to that, like, that's sort of, what do you want to do? Like, that's an interesting question. But there's another part too, is like, how do I want to be with those experiences? Those difficult experiences, painful ones, or maybe, if I'm honest with myself, experiences I don't really want. Like, how can I skillfully be with those experiences so I don't get myself caught up and tangled up in knots?
Why do you think we fall into the trap in the West of thinking we have to be a certain way internally before our life can look a certain way externally?
It's a big question. I think there's probably a lot to that. Clearly, there's a societal thing, and the societal messages about what success looks like, or what, how we should be. And I can see there's evidence to suggest social media compounds that. It's not all, it's not social media is bad always. Sometimes it can be incredibly helpful. but there's aspects to it that sort of promote a version of life and living that's, happy and the absence of negative thoughts and experiences. There's another piece I think that's part of that, that's also that it's very easy to compare our insides, what's going on inside, with other people's outsides. And if we live in a culture that doesn't easily communicate or doesn't rapidly do that, then we can be left with this feeling like this thing on the inside is different to what everyone else has. Like, therefore, everyone else appears to be evidently happy or fine, and I'm not, because I can feel myself on the inside. So then, as a result of cultural messages and, ideas, it can then rapidly turn into this relationship that we have with our internal experiences that may be kind of problematic.
Yes. And I think in keeping with that, the other problem we have culturally in the West, I think, is that things have gotten so good in so many different respects that we've lost the sense that life is really difficult. And we're bombarded by messages that suggest explicitly and implicitly that life can be really easy breezy if you reach a certain level of success, which I think is really kind of an illusion, because often you look into the lives of people with a lot of success and find out things aren't as rosy as they appear from the outside. And so every time we run into the everyday humdrum ups and downs of life, the randomness, the bad luck, whatever you want to call it, there's the unpleasantness of that. But then there's this additional layer people seem to run into of, not only is life hard, but my life being hard is yet another piece of evidence of my failure. And I think so we have this compounding problem, which I guess the tonic for that I've seen in my life is Eastern philosophy, where rule one of Buddhism is life is suffering. So you have to have this understanding that there's this base layer of difficulty to life. And it sounds like ACT kind of incorporates that with the acceptance piece, because presumably the things we're going to be accepting are the things which are a little bit difficult to accept, a little bit unpleasant.
Yeah, precisely that. Yeah. Doesn't it just flip things on its head, doesn't it? When you sort of approach life, like, it sounds so counterintuitive. It's so sort of the opposite in terms of the sort of the meme or the idea about what life should be about. But it just flips things when we say we come from a baseline, life is difficult. And then, okay, we can, I don't know, sit with that knowledge and allow that to sort of permeate and percolate through. And then sort of like, and then what? Which is a nice thing. But there's something I find so paradoxically peaceful about that message, like life is difficult. And I think it's just like what you're saying there. What it does is strips out this idea this really insidious idea that life shouldn't be difficult, that life's easy, that it's straightforward and everyone else is having a breeze. And if you just be like everyone else, it should be fine. But when we sort of lean into that place of, things are difficult, it's hard. Life is incredibly complicated. It's filled with loss and pain and suffering and complexity, and we're constantly getting things wrong. However we look at it, we're missing out on opportunities. We're making decisions, the wrong decisions all the time. And that's life. And it's not in like there's a doom and gloomness to it, but it's not in a way that's like there's that invitation to really lean into and breathe into this knowledge of this is the reality of human existence. And when we do that, that's when some really interesting things open up. Some really cool new possibilities that I think are really exciting. And that's the sort of the paradoxical bit of that piece of wisdom, I guess. And yeah, you're absolutely right. There's a deep resonance with Eastern philosophies that I think this has been a fascinating piece of the evolution of behavioral therapies, of how this is, I guess, influenced thinking around it and has sort of permeated through in a way that perhaps hasn't always in Western psychologies and Western understandings of mental health. So it's a fascinating time, I think.
Yeah, and I think often psychotherapists in many ways have become like the priest class of Western society, given that major religion has declined quite a bit. And people often look to psychotherapy for some sort of spiritual guidance or guidance as to how people can find meaning in their life. Just reflecting on the last point about culture, it's like if you think life is easy, then you expect to have it all. Like you expect you can have anything you might want. And as soon as you can accept that life is difficult, that's when you have to start triaging, right? You have to be like, what's important? You have to start prioritizing. And to me, that's where the values come in, because values, in other words, like what do I care about, implies a priority. If I value honesty, that means I devalue deception. So it means I have to dispense with the parts of myself that might be prone to dishonesty. So there's something about coming from this humble place of life is difficult that says, now I have to, because life is difficult, I have to choose certain priorities, choose certain values, which seems like, we can overemphasize the sacrifice part. But what's lying underneath that, of course, is what are the real strong pillars that I want to build my life around.
And an important question that comes out of that, what do I want to build my life around? Like what does matter? It's this is maybe a little bit poignant for me, Alex. I turned 50 on Saturday, and 50 feels.
Congratulations!
Thank you. I've made it halfway. Well, halfway. That's optimistic, isn't it? Half century at least. And there's something about that. I think that there's, at least in my mind, there's something about this sort of idea of time running out. And it doesn't have to be 50 or whenever. It could be any age. We sort of get that sort of feel like, because life on this planet is short. It's limited. And I think that's part of the human existence, is that this realization we do have to make decisions about how we spend our time. We're not going to be able to do everything. And what are the things that are most important to us in this time? And how do we ensure that what we're doing in this moment is reflective of the things that we know bring us, what are the words? Things like joy, perhaps equanimity, peacefulness, purpose, meaning. And one of the things I don't know, I've got better at is just catching my busy, problem-solving, slightly judgmental, critical mind that says to me, Joe, you should be doing more. You should be climbing mountains and achieving more and more. And it's, this constant sort of sense, time's running out. You got to do more. Just being a bit gentler with myself, just to say that answering that question, I think, what is purposeful doesn't mean I have to pack my life with lots and lots and lots more. I don't have to go out and get a jet ski and kind of go zooming off on the sea, to fulfill that. Often, in my experience, again, paradoxically, it's actually sort of less. I do less stuff. I spend my time sort of just prioritizing maybe a small handful of things, or activities, or relationships, or things that are just happen to be important for me. And it's this sort of weird thing, isn't it? When time's running out, it's easier to sort of do that. If you've got like 100 years ahead of you, then everything's possible. When time is a little less, then you have it's like a gift to just distill down into sort of just the handful of things. A gift to invite yourself to answer that question in that way.
Well, a lot of people, forget about mortality, understandably, because it's not something someone wants to keep at the front of their minds a lot. But the Stoic philosophers actually had made a practice of keeping death in mind. So they used to do like death meditations. I think that was called like memento mori or something like that. Keeping death at the front of your mind, because that helps you shape your priorities and values. And same with the existentialists, where they, often existentialism is viewed kind of pessimistically from the outside, because it's like, oh, you're thinking about death and your very human predicament. But it can be quite optimistic in the way that we've said, because if you understand that life is limited, then that kind of kicks your brain into action. Okay, what do I really want out of this limited life?
One of the neat things I like about the ACT approach is that, because it's a behavioral approach, it's fundamentally behavioral. Like it might look on the outside sort of a little kind of fluffy and whatnot, but when you dive into it, it's deeply behavioral. And of course, then asks questions like, how does that get translated into action? Like, what does that look like? How do we start shaping up and influencing people's behavior? Or how do I influence my own behavior? So then one of the things I really value about asking people about purpose and meaning is that, because I think it's easy for people to go, well, what do I value? I value creativity, or I value my family, I value my friends. And that's understandable. Those give you a sense of domains. But what I really want to hear about is, how do we allow that to influence your behavior moment by moment? So, for example, if I was talking with a client, say, who was struggling with something really painful, say, for example, self-criticism or feeling really sad and low, that rather than values being an abstract thing I'll get around to doing in the future, that I might be asking them questions like, what could you do? Like, if you had your values front and center right now in this moment with me, as your mind is like super critical and you're feeling this deep well of sadness, and if I was to like invite you to bring a key value into this moment, and I'd be a little less abstract than that. I'd kind of have like a clear sense. If they had a value about saying being a good parent, I'd say, what would that look like right now if this value was speaking to you and just sort of influencing you, guiding you, and suggesting how you might be with yourself in this moment? Like, I wonder what that value might say. And in that way, kind of allow values to sort of come up in those moments. Because the other thing I think it's really easy, from my experience, in doing therapy and personally, like values sort of get pushed aside. It's like, oh gosh, I'm too stressed or I'm feeling too upset or whatever to think about what matters. But that's exactly the time to be asking those questions. Like, another nice question is, if you were being with yourself in a way that reflected your own values, if you're holding yourself, treating yourself in that way, how would that look? And, a client might say, well, if I could, I would probably treat myself with kindness and care. Okay, great. And we have a sense now, because kindness and care is an important value. Like, what would that look like? How would we enact that? How can we together kind of build ways to develop those strategies? And that's, I don't know, that's when I've seen like the power of values sort of really come into play.
And I think that's really that's the essence of psychological integration. A lot of therapies talk about psychological integration as this thing to strive towards. How do you become kind of integrated personality? And I don't think I can think of a better way than reflecting on what your values are, trying to get a sense of that, even if it's a bit low resolution at first. And then how do these values actually translate into my day-to-day life? Again, like, okay, I value honesty, but I lie all the time. That's not an integrated way of being, right? So you have you have to sit down and be like, okay, I value honesty. So what would a more honest life look like? Or I value family and close relationships. What does my life look like if I translate that into behavior? And again, I think ACT is the only therapy I've come across which makes this explicit. So I'm very happy to hear about it. Is it common for you to find that your clients often don't have a strong sense of what their values are going into therapy?
Yes. I guess the way to answer that was, it depends. Probably a rule of thumb would be the more difficult and bigger the problem or issue is the client is there for, the more likely it is they'll have less of a sense of values. On one end of the continuum, when I've done coaching work, for example, which is maybe some, I don't know, a little less, people in coaching typically would come with problems that are less stuck and entrenched. It might be quite common in the very first session to really dive into values and ask about what's important. In my work, though, for example, with people like young people with psychosis, we said before we started, like I'd worked a lot in National Health Services, community teams, inpatient wards. I found typically we would find people there would not have a strong sense of values. And there's a number of reasons for that. One would be often, if they've experienced huge amounts of trauma, disruption, family issues, they're not environments that allow a person to start to answer the questions about what's important to me, like what are the things that I like in life. There's of course an identity question in there. It's sort of connected to who am I and what are the things that I'm about. The other thing, of course, is that even if they do have an understanding, they might be very cautious about enacting upon those. Who am I to ask for what I want in life? Or every time I've wanted something good for me, it's never worked out. It's only ever brought me pain and suffering. So I don't want to go anywhere near things that are good for me. Those questions then can be hard, incredibly painful, and might even be a question that sort of is posed but unfolds over time. So over the whole course of a number of therapy sessions, I don't know, like tons and tons, it could be 6-12 months. And that towards the end, that question can really start to be actually answered, in a real meaningful way.
What are the best ways to help people kind of answer this question of what do I care about?
You could, one way, asking the question, I probably don't use the word so much of values, because I don't know if it's got a lot of currency with a lot of people. I think people kind of get purpose or meaning. I might ask you, if I was to ask you, Alex, like what are the times in life where you feel most, I don't know, vital, engaged, and connected with you and yourself and people around you? Would you know those times?
Yeah, but because I've spent a lot of time thinking about it. And yeah, so I mean, I liken this values question to almost like walking along the beach with a metal detector, where you're, in life, you're thrown in lots of different situations, especially as a child, lots of situations not of your choosing. And some things are going to feel really aligned with you naturally and connected, as you implied with your question, and some things aren't. I was never going to be a poetry person because for whatever reason, poetry just doesn't get my sense of fascination going. But something about psychology does. Something about talking about psychology or learning about it really, in an involuntary way, engages my sense of meaning and fascination. And I think everyone's going to have their things which jump out at them and which for them gives them that spark. So usually what I recommend, especially to young people, is just try a whole bunch of different stuff and kind of watch out for that felt sense in your body, even of like, wow, I really like this. I would do this for free. I just feel so happy. Or you used the word peace before, equanimity. I feel really at peace right now. I feel like I could do this all day, that kind of thing. So I definitely recommend, for if you really don't know what your values are at all, that kind of experimental approach. And then you can kind of get like a low resolution view. Like for me, it was, I trained as a doctor, and there's something about many aspects of being a doctor which went for me, I think. So then of all the different specialties, I chose psychiatry. And then within psychiatry, I really liked psychotherapy, so I kind of doubled down on that. So this kind of, you can imagine like these Russian dolls where you're kind of getting smaller and smaller and more specific. So that's usually the advice I give to people about how to go about it.
Yeah, that's great. You'd make a good ACT therapist, Alex. That's perfect.
Yeah.
I love what you're saying there, because the thing I really like what you're saying is there's like tons of wisdom packed into that. The bit I like, though, I hear you saying is like listening to your body. That's so important. Like, and it's not always easy for some people, I don't know, trauma history or history of sexual abuse or all the things that interfere with connecting with body. And that's why clearing the decks in therapies to be able to do that is so important. But that's a key skill. And also, like what you said, there's go out and try a whole lot of things, go and experiment. And I love that idea, because isn't that cool if we can say to our young people, just go and try lots of different things out, and at the same time listen to your body and let that answer emerge, which says to you, yeah, these are the things that they're really good for you. This is the things that resonate with you. It's a bit sad because I don't think our educational systems always match up with that, and people are expected to make decisions really early on before they've already had a chance to experiment. The other thing I do when I'm working with people is, it's interesting, like when I was listening to you talk then, I could sort of see your enthusiasm for this. It was like, wow, it was shining through. It was like, obviously you kind of thought about it and, you've talked about this no doubt lots, but I can just feel that enthusiasm myself. I can feel myself get excited. It's like, wow, that's really cool. And I can see, that Russian doll metaphor, and you get them narrowed down. It's like, all right, I'm learning something really important about you. And that's another thing I often would do in therapy. I'd sort of be listening to myself, and the times often when people are talking about values and I'm starting to feel something emotional on the inside, typically are those times I'm resonating with them talking about something important. The opposite, of course, would be if someone is talking about like, yeah, my family is important to me, my work is important to me, and on the inside I'm just like yawn, dry, dusty. I'm like, that's an interesting therapeutic process. Like it probably says to me, we're not getting down to business here. You're giving me something because maybe you want to say this is what you think I want to hear, or you should say this, but I don't really feel like I'm getting you showing up in the room.
That's a really important point. And I think one thing to note about values is that very often we have values inherited from other people, often our parents or teachers or siblings, that aren't really our own. In other words, we're told what we should care about rather than what we actually care about. And that can hugely distort the trajectory of someone's life. Like someone always wanted to be a doctor, instead they became a lawyer and they just hate being a lawyer, but in their family being a lawyer was the thing you had to be. So in Gestalt psychotherapy, you call that an introject, this kind of internalized belief that isn't necessarily aligned with who you are. So I guess that must be part of the ACT process, is that kind of decontamination of what do I care about versus what I was told to care about.
Sure. Yeah, definitely. So the piece there about helping people to develop that clarity. I like that word. That's an interesting metaphor you're using, the sort of decontamination, which is...
So I should say decontamination is actually lifted from transactional analysis.
Aha. Okay, you're right.
Which is this, if anyone knows anything about TA, there's this like parent, ego state, adult and child. And there's thought to be at times contamination between the ego states, basically where you think parts of yourself are contaminated, so to speak, with outside influences.
So if there's a task there, like a developmental task of getting some fidelity, as it were, to values, there's a piece there that requires, from an ACT perspective at least, of being able to connect in and listen deeply to our emotional and body state, the things that will give us information about what's important to us. At the same time, though, there's that piece, and I guess it's sort of, I don't know much about TA or decontamination, but it does strike me as a kind of potential parallel, which is to say that we, from an ACT perspective, we're also looking to tune into and become more mindfully aware of our mind at work, which is to say the ways in which rules that emerge, either from our developmental experience or cultural history, and the way that we respond to these rules or cognitions, thoughts, beliefs in very literal ways that interfere with our ability to take action towards chosen values or limit ourselves in terms of, like, I have to be a certain way, or I can't upset anyone else, or I can't do a certain activity if I'm feeling a certain way. So helping to notice those rules and respond more effectively to those rules and thoughts.
So you're talking about this kind of over-identification with the sort of ups and downs of our mind at any given time, like our minds will throw up thoughts of, oh, I don't want to do this. You over-identify with this thought. Or this is scary. You over-identify with that thought. And I guess what I see really commonly in terms of when I'm working with people for behavior change is just that sense of, like, I know I kind of should do this behavior, but I don't feel like it right now. How do we deal with that? How do we start to help people distance themselves a bit from that?
Yeah, it's such a common one, isn't it? I think I might better relate to that myself. And I think about all the things that I've had an injury recently on my shoulder, so I can't play paddle. Have you come across paddle before? It's like it's incredibly popular sport around where I am. Anyway, it requires there's a sort of gentleness to it, but it does require sort of a certain move. Anyway, long story short, I'm injured, had to go to physio. Physio said, hey, you need to do, surprise, some resistance exercises with a rubber band, as physios always do. I knew it was coming. And I've had that repeatedly, that experience of, it's like, 8 o'clock at night. And I was like, I haven't done my exercises. And it's like, I know I should do my exercises. It'll be good for my shoulder. My physio said I want to get back to playing, but I don't want to, because I want to sit on the couch and just relax because it's been a busy day. And who on the planet of the earth couldn't relate to that in some possible way, right? And, it's such a human experience. And kind of unpacking that, it's good because it's just so normal. It's just so human. And it goes from all those sort of like, I don't know, stuff like doing exercises for my physio rehab, through to all sorts of things, like to telling my partner that I love her, for example. And my mind go, oh, don't say that. That's a weird thing to say. Or she's going to, I don't know, she will think it's strange. Or real men don't kind of say these kind of things, or whatever ridiculous stuff, that might get in the way of an incredibly profound, important move in terms of us taking action. So, well, and again, there's many ways to deal with it. An ACT approach would be to do a few different things there. And there's many ways I could do that. One of first of all would be kind of notice that thought and action. So with my rehab thought, it would be, I don't want to do this. I want to sit on the couch. And kind of what's happened there is, there's a process that's happened. This thought has emerged along with, many other probably within the last 5 minutes. dozens, potentially hundreds of thoughts over the day, thousands of thoughts. And this is one that I've allowed to influence my behavior. This is the one that I've chosen. This is going to determine what I do next. And so there is an over-identification, attachment, or ACT would call it an effusion, like this thought becomes me. This is a truth that this is the right thing to do. And that may be the right thing to do, but it might not be either. And imagine I could just, if I could, slow that process down for a second. And it's not always easy because it's often happening so fast. But if I could slow it down and just sort of have that thought there with me a bit, slow it down and pause and say, and the thought comes out, I don't want to do this. I just want to sit on the couch. I'm too tired. Or I just still it down. I'm too tired. I could just allow that thought to be there. Just, notice it. There's that thought saying, I'm too tired. And rather than the thought, if I had my hands to represent like being right up here, I'm too tired, I'm going to block out and, influence you. I just pop it out in front of me and go, there's that thought, I'm too tired. I'm noticing I'm having a thought that I'm too tired. What a weird thing to say, but I can do that if I want, right? Slow everything down mindfully, just take my time with this. And as I create a little space from this thought, the thought is there and here's me noticing it. I'm different to my thought. My thought is not me. It doesn't have to be in charge of me and tell me what to do. Maybe it does, but at this moment I can just have some space. And if I was like putting this down to kind of like, ultra slow, I could even ask myself, what do I want in this moment? Okay, maybe I do want to kind of have a rest on the couch. It has been a busy day. And I also want to get my exercises done so I can keep my arms strong. So I want to play paddle, that kind of weird pickleball kind of game. And so I get to have a say about what I do, not just the thought that happens to pop up in the moment. And I get to sort of say, well, you know what? Okay, I'll get the exercise done and then I'll have a rest afterwards because both of these things happen to be important. But this particular thought is, I'm not going to let that, determine, boss me around, govern my actions or my behavior because, gosh, this is so one of many hundreds of thoughts. Like, why that one?
Absolutely. I mean, having a human mind is kind of like sitting in an office and you're the CEO and all day, like you have an insubordinate employee like bursting into the office and saying random things which are unhelpful a lot of the time. Like you're too tired or you'll never make it or like self-critical thoughts, judgmental thoughts about other people. I think the most common trap people fall into is they identify with that employee bursting into their office and not as the CEO. So I think there's a ton of ways to do this, therapy, meditation, coaching. But I think what's essential for people to have a little bit more control of their lives is to start to cultivate the CEO kind of mindset of I'm in charge, I make decisions. Sometimes they're hard decisions. I'm not the employee bursting into my office saying something unhelpful. I think it's very hard to eliminate that thing happening entirely, although I think you can reduce it a lot with time and practice. But the key is not to over-identify with it. To be like, okay, I'm having your mind, for whatever reason, that I'd be curious to speculate about why, your mind just kind of at random is always spontaneously producing all of these thoughts is the first thing you realize when you start meditation. I sit down to meditate, I'm told to focus on my breath, and thought comes in. What am I going to have for lunch? Or what am I going to talk to my partner about? Or how am I going to solve that problem on my Excel spreadsheet? And you need to detach from that because very rarely is it helpful. And even if it's helpful, it's too scattershot and random to lend itself to kind of a well-lived life.
That's a great metaphor. You're good with metaphors, Alex. This is like you're peppering them here.
Thank you.
I really like that one. And you're absolutely right. The meditation, anytime one sits still, that's when we get to really experience the full force of our minds and just the bizarreness or the randomness or just the connectedness. It's just like, it takes hardly anything for connections just to start kind of whirring away. And before we know it, we're lost and we're pulled off in all sorts of places. The thing I like about your CEO metaphor is this idea that we do have a bit of choice, like we do have say. It's not the particular thought on that particular moment who might come in that sort of very anxious, panicked, stressed or commanding, bossy, bullying way, whatever it is where the thought is looking to influence our actions, that we have that space to do something different. And that's certainly one of the powers of, or the skills that mindfulness meditation teaches, is helping to slow that process down, to become more observing of it, It's become more aware. Certainly not, well, I guess, it does seem like the research indicates that some people with extensive training, maybe in certain contexts and moments, have perhaps a frequency of fewer thoughts. But that's not really the point, though, right? It's not to have less thoughts. It's more to, when I'm stressed out, I'm freaking out, and the kids are yelling at me, I'm late for work. What do I do in those moments? My mind is saying, you're gonna be late. You won't get the kids to school on time. You're a terrible parent. You're useless as always. What happens then? Like, imagine that's the time where, for me personally, I most need those abilities. Not where I'm sitting in a cave on a mountaintop and it's all peaceful and calm. It's like those moments of real life where I need an ability so that that employee doesn't come bursting in and starts governing and taking over. Like, I can have those thoughts, and with a bit of spaciousness, I can go, great, thank you, appreciate you trying to help and trying to get things on track again. But if I was to try and ask myself the question, like, what kind of parent do I want to be? I want to be a parent that is relatively as calm as possible, is helps gets the kids there, models and demonstrates kind of love, care, and attention, then allow that to influence my behavior.
Yeah, I think if there's levels to this process, I think probably the first level is just that awareness of you have this voice and not identifying with it and realizing that this voice isn't entirely you. It's kind of like a part of you, and there's this other separate parts of you. And then I think the second step is to detach from that more and more. So it has the negative stuff, you're less reactive to it, you less identify with it automatically, and therefore influences your behavior less automatically. I think there is an aspect where perhaps you can lessen the thoughts with a lot of training. But I think maybe the more realistic goal is actually that I do think those voices can become more helpful over time and less overtly bullying or tyrannical or judgmental or negative. And that's where I really value, like, aside from therapy itself, which I think can be useful, like often if someone goes to therapy, they can internalize the voice of their therapist. So instead of having like the sort of abusive father's voice in their head, for example, they have a helpful voice. But also practices like journaling, I think, can be very useful. With journal, where you literally correspond with yourself, or using your phone to actually talk to yourself. I find those kinds of techniques, in my experience personally with my clients, actually really helps to mean that even if those voices come up, they're slightly more likely to be a bit more helpful, a bit more compassionate. I'm curious if ACT sort of incorporates any of those kinds of ways of working.
You're talking about ways in which we can foster a healthier relationship with ourselves. So rather than a relationship that's perhaps characterized by disorganization or randomness or constant fighting, a relationships to those aspects and parts of ourselves that is more settled, kinder. Not to say that means that we always have to be at one with ourselves at all times, and there's not scope for any difficulty, but a bit more where we can be listening to ourselves more clearly, and taking some advice from those different parts as is needed. So those kind of dialoguing approaches, also in my experience, super useful. Anything that allows us to be able to bring the kind of a sort of internal world and bring it outside, so we can see it more clearly. Someone once, a good friend and colleague of mine, once described as sort of like these internal experiences as being like a bit like a barrel full of eels. And when you kind of look down on it, you can sort of see it and you can get the swirling nature of it all. But it's hard to do anything with that. It just moves so quickly and fluidly. So writing things down just allows a sense of spaciousness and distance from that aspect of ourselves, or talking with a therapist, or making a note on our phone. I'm assuming probably, I'm a little cautious about this, but probably AI is going to have a big say in all of this. I'm cautious just because it's I don't know, a little unknown at this point. But I think those kind of things you're describing then, carefully done in the right context could be super enormously helpful. Having a way to be able to voice an internal experiences back and then have someone or something else respond in a way just about to hear those things back a little bit. Shape up a bit and develop a different perspective. So rather than the swirling barrel of eels we can't really get a grasp on, we can just slow things down in a careful and considered way. And then, those are the places when we're going to be able to respond, hopefully more effectively, more in line with our values.
Yeah, and there's something about behavior. You said that ACT is fundamentally a behavioral approach. I'm always sympathetic to behavioral approaches because there is something about doing an action in the world which helps to decrease that swirling complexity of our mind. You do something and it doesn't work well. You at least know what not to do. You take all of the complexity and the overthinking and the overanalyzing and be like, okay, I tried this is what happened. And all of a sudden, your consciousness can kind of contract around what didn't quite work. And then obviously it's really beautiful when the opposite happens. You do something, maybe unexpectedly it works. And all of that swirlingness for a moment falls away. And you're like, this worked. Like the first time, I don't know, you're seeing someone in a therapy session and they have like a really cool insight about themselves. And like they know it and you know it and you're kind of like locked on in that moment. And all of that swirling consciousness complexity falls away in that moment. You're like, okay, there's something about what I did here which worked. That's the beauty of trying all those different behaviors. They take all that mess. People spend so much time thinking, what should I do? What if I do this? What are the pros and cons? And I again, we don't want to overly criticize Western culture, but we live in a culture which allows for an action. That's the problem with technology, even AI, which you mentioned. It allows us to take a back seat and think and overanalyze and plan, where I really think we should be doing and experimenting, albeit in a safe way, a lot more.
Mm-hmm. I couldn't agree with you more. There's so much of, I think, psychological problems come from that, inaction. Not always, but there's a large part of it. But inaction can happen in so many ways, right? It's like the people's response to stuff that shows up on the inside is to try and not kind of like move through it in a way that's of an outside action, but to go up in their heads and figure it out and plan it or ruminate on it, try and worry about it, predict and take it away somehow, solve the equation of our internal world, which is of course an impossible task. There's a Kelly Wilson. It's a sort of paraphrase. I mean, he's one of the early originators of acceptance and commitment therapy, and he's a psychologist. He's now retired. Works in the States, but he sort of talks about this idea that, which I always really liked, which is, imagine we could respond to our difficulties and pain. I'm kind of paraphrasing a bit here. Rather than respond to those things that show up on the inside, rather than like a maths equation, that we could respond to it as if it was a beautiful sunset or a beautiful piece of music, which is to say that if we could find a way to appreciate those things, have a stance towards those experiences, which, had some potentially the things that I imagine like as connection or compassion or kindness, rather than trying to eliminate. And I go up in my head and trying to figure it out. Like if I was in the world, gathering experience, doing more. Yeah, absolutely. I love what you're saying there. Those moments, in therapy where people are talking and they have an experience, and it's like, it's amazing. You've got some real data here. This is cool. Now we've got an understanding. Whether it's good or bad is not really the point. It's like actual data rather than just this head stuff, which is trying to predict and, figure things out. Let's work with the stuff right in front of us. Let's try and kind of build towards ways in which you can get these actual experiences and figure things from there rather than trying to model everything.
If someone was struggling with certain issues and they were considering psychotherapy of some form, what might be the indicators or the red flags that like ACT might be the choice of therapy for them?
There's a few ways to answer that. One would be an evidence one, of course, in terms of what ACT has good evidence for, like chronic pain, for example, good evidence for psychosis, trauma, anxiety. It's workplace stress, interestingly, resilience, well-being are good places. And there's probably something in there, which is it being a model whereby it's helping people who struggle a lot, who are inclined to try and get rid of experiences and get caught up in, like, for example, pain or physical health problems. You can see are classic examples. Like, how could one not struggle with pain? How could one not just be focused on trying to eliminate that experience, given that everything we do about pain is to try and reduce it. And our treatments for it are largely about reducing it. And then what does one do when those things don't work? And any person in their right mind would try and continue to do that in some way. And then, what does one do then when those things aren't working? How do we help a person respond effectively in that incredibly tight spot and not do things to make the problem worse, do things that allow them to have a life that's meaningful and purposeful? So you can sort of maybe hear some of the things, I think, then that sound like where an ACT model could be super useful, where there's lots of struggle, where it's very mindy and heady, where there's a place where values are going to be really, really important. You could probably say that it sort of points to a lot of things. But, those are the particular issues, I think, where that stands out more.
And if someone did ACT therapy, would there be, for example, much of a focus on the past, childhood, similar to psychodynamics, say? Is it sort of disregarded entirely, or is it somewhere kind of in between where we try and get a sense of how early experiences might have had an effect, but not maybe dwelling on them? Some people seem to fear that a lot about therapy in general, that therapy is all dwelling on childhood, which I think is a misconception I'm keen to dispel. But what sort of ACT posture towards early life experience?
Yeah. I'm glad you're dispelling that, because it does put a lot of people off. And I guess if you thought that's what therapy was about, I guess understandably, of course it's not. ACT, the annoying answer would be it depends, which is to say that for some interventions, some issues, then it might not be relevant. For me, and most, I think, ACT people would say to have a good understanding of where someone's coming from and a functional, you can understand how this issue works. You just have to know their backstory. You have to know where this stuff originates from. Where we talked about at the start, like history, right? Like straight away, what's an therapeutic approach's origin story? Without knowing that backstory, that's so hard to know here and now. Like, why does someone respond to this particular problem in such a way? Like, why is sadness so aversive for them? Why do they have this story about anxiety? Like, where do they get their identity from? Like, why can they just not have this experience? And those are questions that can only, in my experience, be answered by a good exploration of where they've come from and what their developmental history has been like, their learning history, typically family of origin, but not only, all those experiences that come to the right here and now. I think all good therapies do this, right? Which is to say, understanding someone's history in order so that the practitioner can help the person in the here and the now. And ACT would certainly fall into that camp. If it wasn't useful, then it might be something that was not focused on. But everything is about helping the person in the here and now change, flourish, and grow. And if that's needed, then absolutely, that's part and parcel of the approach.
Yeah, it's always so strange how you hear a lot of influencers, often influencers more in the business space, people who are very pragmatic and disciplined, will talk about how therapy is just about dwelling on the past and how that doesn't make any sense because the past won't, dwelling in the past won't help you solve your problems. But of course, just taking a few moments or, a few hours even to think about your past, how it's affected you, is going to be so crucial to understanding just your blueprint, how it's shaped how you see the world now, how you perceive the world differently from someone else, and how you might be able to perceive the world differently in the future, were you to bring new experiences into your life.
Yeah, absolutely. Totally agree. Yeah. It's interesting. I mean, in my experience, most people do want to talk about that. They kind of sense that there's a story they kind of want to get to go through and understand. Usually when people say, nope, absolutely not, I'm not talking about my past, then, okay, I'll remember that. And I'd like to understand more about why that's such a no-go area.
Yeah, it's a bit like when someone says they don't want to use the treadmill because they get out of breath straight away. That means you really need to use the treadmill. So similarly, if you can't talk about your past at all because it's so painful, that's a sign maybe you need to start unpacking it a little bit.
It's usually a good sign. Absolutely, yeah.
You wrote a book about self-esteem. I'm really interested. That's another topic, where sometimes people will sort of debunk this idea of self-esteem. Self-esteem being too woolly or a sign that we're mollycoddling people. What do you see as the place of good self-esteem in someone's psychology?
If we could have, we would have called the book, couldn't think of a snappier title, but about self-acceptance. Self-esteem is such it's a knotty topic. It comes from all the self-esteem research and programs back in the 80s that try to boost people's self-esteem. And it turns out we're pretty good at doing that. The problem we didn't really ask ourselves is what happens when you do boost people's self-esteem. And what you get is a bunch of narcissists, people who are internally focused, who don't focus on cooperation, community building, caring, compassion. Those are the things that get stripped out if we focus exclusively on making an individual feel better about themselves. The other kind of downside is that any self-esteem boosting is really brittle because, I can look at myself in the mirror and say, I'm a great person, I'm fantastic, I'm strong. And for 10 minutes, I'll believe that. And, I'll score on my score to say my self-esteem is high. As soon as something goes wrong, then that falls apart. I get a message from my boss to say, your performance has been terrible, or have an argument with my wife to say, you're a horrible person. Then suddenly that thing just falls apart and I feel even worse than I was. Because what's wrong with me? Why can't I have high self-esteem? So the kind of, the approach in our book was about how do we develop a healthier relationship with ourself, and ourself kind of like is this idea, this piece of like this identity, like who we see ourselves to be. And a healthy sense of self would be an identity or identities that's fluid and flexible. If I was to ask you, Alex, like, who are you on Sunday morning? Who are you on Friday after work if you've had a few drinks if you drink? Or who are you on a first date? Or who are you when you meet your parents? Of course we have different aspects of ourselves, right? They're fluid and they change. Typically, the thing that, when we're talking about the self-esteem or self-identity or self-problem is when people are like really rigid and stuck. This is who they are across all situations. And it'll be something like a negative evaluation about themselves. I'm a bad person. I'm worthless. I'm horrible. I'm less than. I'm invisible. Or the kind of the sort of the narrative, the verbal language-based narrative that tries to summarize and encapsulate their whole personality. There's a simplicity to it, of course, right? Like as if we could just capture one person in 3 words, right? And yet it tries to do that and tries to, help. It's trying to consolidate, distill down someone and make life sort of simpler in a weird way. And yet, of course, in an incredibly destructive and painful way.
So there's the self-destructive, self-critical stuff. And then there's also like injunctions like I must be, like I must achieve 100% every time. I must take up as little space as possible, say. Like,
if I'm a bad person, then there's a whole lot of things that flow out of that, doesn't it? Immediately. If I'm bad and you're good, then I must always hide myself away because Alex is going to see I'm bad. I can't let him see who I really am. Or I'm bad. I've got to try and prove my worth and I'll talk myself up and how great a psychologist I am and, and how terrible you are and, all those kind of very inelegant, blunt ways that some, people can interact socially. You can sort of sense the self-story in the back driving things. So a bit of this then, this work from an ACT perspective is unsurprisingly helping people to see this thing in operation, to notice it, understand where it came from, understand why it does what it does, the protective nature of it or the kind of trying to helpfulness nature of it, to see it happening and then develop a healthier relationship with it, i.e., not it automatically. I hear myself sort of talking about it, and often we try and develop a metaphor with this, like to give this narrative a bit of a character, like develop a sort of an identity around it. So rather than just this dry, dusty verbal label, this thing that's in your life that's like gives you guidance or suggests you or to you how you should do or holds you back or like I had someone describe it once. Paraphrased a bit, but like it was very worried about money, was like and was very anxious, was the anxious accountant, was their kind of self-story, always kind of very guiding them, or the critical protector, always super critical, but always, very protective and keeping them in their place. So, helping them to have a relationship where this thing isn't always the go-to. I don't always turn to this thing and say, hey, what should I do now? What's my next move?
So useful to identify those patterns and flexibility. We do fall into rigidity and we do start, often people can pare down and think of themselves as like just one thing or they have to be one thing. all the time. But of course, what makes human beings is we are adaptable. We can go into different situations and be different things. Obviously, we want to achieve some sort of integrity, having maybe some consistency of values, but integrity doesn't mean that you can't adapt yourself to the needs of a different situation. Talking to your parents is very different to being on a first date.
Probably for most people, yeah.
For most people. I do like to think about the differences between self-esteem and narcissism. I think you're right. It's semantically very complicated. I like the word self-esteem, but I wrote a whole essay that I put on the podcast about self-esteem and why it's different from like good, healthy self-esteem, how that's different from narcissism. And I think for me, it comes down to good self-esteem is an ability to appraise yourself in terms of your strengths, but also your weaknesses and your flaws, being able to challenge yourself, but also being able to accept yourself wherever you happen to be. Whereas narcissism to me is this kind of usually core insecurity around which there's this inflated sense of I'm amazing, I'm special, I'm entitled, I have the right to this, I have the right to that. That's usually how I hold the distinction in my mind.
I read a while ago was an interesting study which I think sort of captures a bit of this, which is about, in a nutshell, it's a really interesting study. I've not seen this design before, but the therapist and clients got paired up together, and patients were asked to rate the therapist in terms of their effectiveness and ability to be helping. And, they were given kind of like a whole set of ratings, and I can't remember what, in terms of how helpful this person was, how good they were at their job. And the study essentially looked at to try and kind of see who the best therapists were in terms of those that were most helpful. And there's a couple of really interesting findings. One, they sort of developed a couple of subsets of these therapists. The one that was a bit counterintuitive was that the therapists who were rated as most helpful were those that doubted themselves the most. And to my mind, I was like, initially that didn't make sense, but I thought about it, and I thought, actually, that does make sense. And I think it's pointing and talking to what you're talking about there, like people who have an ability to hold all parts of themselves and not unrealistically dismiss the negative, have a sense of self-doubt. And therapy is complex, it's volatile, it's uncertain, right? So self-doubt is going to be a big part of that. And then they identified this, super group, the subgroup of super effective people. And those are the ones who both self-doubted and were the ones who were kind and compassionate towards themselves. So it wasn't like a self-doubt of sort of self-flagellation. I'm terrible, and why do I always get this wrong? It was like, I'm uncertain here, but I also will just be, kind as I'm going through this difficult, uncertain experience.
Yeah. And that's the challenge, is to how to balance those and then be like, okay, what's the next step, towards what I want. We're out of time, but Joe, it's been wonderful to talk to you. I think there'll be a lot more things I want to talk to you about, so we're going to have you back at some point in the future. But until then, thank you very much for spending some time with me today.
Thanks, Alex. It's been really nice talking with you. Thanks so much.